My name is Dominique Hoover. I am a nurse practitioner focusing on wound care at LMH Health. For any of your local medical needs, whether it be post-surgical, whether it be your, like I said, topical scrapes, burns, bruises, those types of things, wound care can take care of almost any of it and are willing to see it, assess it, and at least navigate you in the direction that you need to go. My philosophy of care, I would say, is very patient-centered, very patient-driven. I think in wound care, it specifically has to be, again, because pain is a factor, but also just because it is overwhelming and scary and nerve-wracking. But I think the patient needs to be an advocate for themselves, and so I want to educate them. I want them to know all of their options. I want them to know what's going on, and then I want them to help make the choices that they want to make moving forward. No wound is too small. I know that sounds so silly, but we enjoy seeing you. We want to see you, and we would rather you come in and be seen and get you healed up in a week rather than you suffer for 2, 3, 4 weeks on your own and then come in and see us. I feel like a lot of the nerves maybe come from feeling silly, feeling ashamed of maybe how it happened, or feeling like I should have taken care of this, or I could have taken care of this. And again, as a provider, we don't think about those things at all. We just want to help you. That's what we're there for, and it's our job. We enjoy doing it. Local wound care clinics are a hidden gem, and people do not know about them, and people should use them as a resource in their community all of the time. I just wish I could scream it from the rooftops. I think when they think wound care, they think big wounds, right? They think like surgical wounds or gunshot wounds or trauma wounds, and it's not always that. Like, I mean, it's the diabetic foot ulcers, or it's the venous stasis leg ulcers, it's the I caught my hand at work. Like, it's the little things that actually get worse fast because we thought we could take care of it on our own. And so those are the ones that are worth coming in to see us because we can help you.